Good evening. My name is Michael. I'll be doing a discharge teaching for a patient going home, Mr. JD. Good evening, Mr. JD. How are you today?
No, good.
Hello, ma'am. How are you? That's your wife? That's good. So, Mr. and Miss JD, is it okay if I get your video consent to do the teaching, discharge teaching?
Yeah.
Thank you. I'm going to be discharging him. I have a doctor's order to discharge him home today. You guys are going home today. Is that not great? Okay. Um, these are the doctor's discharge paper that you're going to be going home today with. So I'm going to be telling you what is required for the doctor order. Okay. You have your old medication, and then he gave you some new medication to go home with today. Okay. You'll continue taking your old medication. You're on Synthroid, 100 microgram by mouth every morning. It's used to treat hypothyroidism, which is when your thyroid gland is underactive. The symptom of hypothyroidism: rapid heart rate, palpitation, weight loss, increased appetite, sweating, tremors, lack of sleep. Okay? You want to take this medication 30 minutes to 1 hour before breakfast with a full glass of water on an empty stomach. Okay? You want to avoid taking calcium, iron, or antacid within 4 hours because it will interfere with the absorption of your medication. Okay? The side effect, you want to call your doctor if you have any side effect: chest pain, irregular heartbeat, okay, osteoporosis, that's when your bone is brittle, you can have bone pain, muscle ache, muscle pain, back pain, okay, you'll have rash, difficulty breathing. Make sure you keep all your appointment with your doctor and the laboratory. Okay, your doctor will order certain lab tests to check your response to levothyroxine. Okay, the other one you're taking at home too is Protonix. Still taking that? Okay, so 14 milligram by day by mouth every day. It's used to treat reflux disease due to indigestion or gastric ulcers. Side effect of Protonix: you want to call your doctor if you have any of these side effects: abdominal pain, flatulence, dizziness, headache, diarrhea, constipation, bloating. You want to take this medication before meals. Okay? Avoid taking long-term use, as it may cause risk of nutrient deficiency and infection. It may also cause acid secretions. Okay?
Right.
So those are your old medication, and these are the new ones the doctor ordered for you to take. Lopressor, 50 milligram by mouth every day. You want to take it with food because it helps improve absorption. It's used to control high blood pressure. Okay. It treats chest pain, prevent heart attack, irregular heart rate. Okay. And the side effect for this medication, I'm going to be telling you, you want to monitor and report any of this side effect to your doctor. Okay. Low heart rate, that is less than 50 beat per minute. Heart failure that presents with sudden weight gain, swelling in your legs or feet, severe shortness of breath, unusual fatigue or tiredness or dizziness, wheezing, especially if you have asthma. Okay, low blood sugar, low blood pressure, depression or hallucination. You also want to monitor your heart rate and blood pressure while taking this medication. Okay, so you take your blood pressure and then you monitor your heart rate. So if they are too low, you want to hold the dose. You don't take it, okay? And then you call your doctor to let him know what's going on, okay? So don't make sure you don't stop this medication abruptly, because if you stop it, it's going to cause a risk of a rebound, okay, of your blood pressure and chest pain, okay. So the other medication he recommended is Zestril, 10 milligram by mouth every day. This medication too is also used to treat high blood pressure, especially if you have diabetic neuropathy. It protects the kidneys. Okay, then you following? Okay, you take it with or without food. Okay, the side effects too, as usual, you want to call your doctor if you have any side effects, swelling of your face, your lip, your tongue, your throat. This is an emergency because this is a severe reaction. Okay, you want to call the doctor ASAP. Persistent dry cough. That means probably the doctor might need to change the medication. Okay, low blood pressure, dehydration, decreased urine output, which could cause harm to your kidney. Okay, so muscle weakness, irregular heartbeat, these are signs of high potassium. Okay, dark urine, yellow skin, those are signs of liver damage. Okay, fever or sore throat, those are signs of your white blood count. Okay, so you want to avoid taking potassium supplement and salt substitute when you are taking this medication. Okay, monitor your blood pressure and follow up with all your appointments, lab work to assess your kidney function. Okay, so that's the second medication. The last one that the doctor recommends is metformin, 500 milligram by mouth every day. It is used to treat diabetes mellitus, prediabetes, and insulin resistance. You want to take it with food to reduce stomach upset. Okay, as usual, any side effect you want to call your doctor. If you experience muscle pain, okay, weakness, trouble breathing, nausea and vomiting, okay, slow heart rate, stomach pain, these are symptoms of excessive accumulation of lactic acid in your body. Okay, low blood sugar, if you're sweating, confused, dark urine, yellow skin or eyes, that's a liver dysfunction. Okay, numbness or tingling in the feet, that's that you have a lack of vitamin B12, that's B12 deficiency. Okay, do you drink? No. Okay, so you want to avoid excessive alcohol if at all you're drinking, and then you follow up with your doctor for lab work with vitamin B12 level and renal function. Okay, and your A1C and your hemoglobin. Okay. So any question? No. Any question? Okay, if there's anything, you can call the doctor and let him know what's going on. Okay, you have the doctor's number is in here, along with the discharge. So we're gonna be giving it to you. Take home. You can go through them, and any question you can call the hospital or call the doctor. Okay. Any question again? All right. You have a good day. Thank you.